Well, Susan G. Komen for the Cure has transformed how the world talks about and treats breast cancer. The foundation's work has led to early screenings, more research, and most importantly, more survivors. It all started when Nancy Brinker promised her dying sister, Susan G. Komen, to do all she can to eliminate breast cancer. 25 years later, Nancy has kept that promise, working for a cure, and she's joining us today to talk about a newly created Susan G. Komen for the Cure Advocacy Alliance. Welcome to the show, Nancy.
Thank you, today. Thank you for doing this today.
So, thank you. I should be thanking you for doing what you did. Can you talk to us about the foundation? How did you even come to say, you know what, I'm going to start this. I'm going to just go ahead and do it myself.
I promised my sister. She was 3 years older than I, my best friend, and when she was 33 years old in 1977 and developed breast cancer, we went through it together, and it was devastating for me to see what happened.
33 years old, so young too.
Yeah. And in those days there were no 1-800 numbers, there was no website, there were no computers,
right.
There weren't cell phones.
Right.
There was no way to do this, but I promised her that I would dedicate my life to eradicating this disease. And Susan G. Komen today is the largest grassroots breast cancer organization in the world.
See it everywhere. It's amazing. And I know she'd be so proud just to see where it's come. And the Advocacy Alliance has been created. Tell us how this is going to work. Is it going to be any different?
It's going to be different in that we are going to really sincerely support legislation and in areas of patient access care, streamlining the FDA process, supporting and energizing basic research, and making sure that patients can navigate through the medical system, supporting people who are having issues with Medicaid, Medicare, and protecting the healthcare safety net in this country, and educating people. This is going to be a very bold new project of Susan G. Komen, and in fact that's where my office will be, Office of the Founder there, and I'll be working along with everyone else.
That's amazing.
To affect the changes we need.
You have held some impressive titles, and I've got to read this. You were the U.S. Chief Protocol Officer up until just a few days ago, right?
Right.
Ambassador. What was it like working with so many heads of state, and even with the former president as well, too?
It was amazing. President Bush was an amazing leader and very punctual and had very clear objectives. But I took this position as a real opportunity, not just to serve the president, the White House, and the country, but I took this opportunity to really get to know leaders of the world who would come to visit him, and when we would make visits all around the world.
So did you find yourself being able to increase breast cancer awareness in foreign countries as well as part of your role?
Dramatically, cancer awareness, because of course leaders do their research on who they're meeting and who will be greeting them.
Right.
And it wasn't just a few minutes into any introduction before they would say to me, Ambassador Brinker, I want to ask you a question about cancer. I want to talk to you about breast cancer awareness and how we get involved. It was an amazing opportunity to visit upon their request.
And I asked you this earlier, but is there any country in particular that you could say, you know, their breast cancer or cancer awareness was here when you started and is now here?
Well, I think when I served as ambassador to Hungary, there was another opportunity to increase breast cancer awareness. When I got there, people weren't talking about it. The government hadn't been aware of it, and now, thanks to the leadership of their Prime Minister and his wife and many, many others in their country, breast cancer awareness is much higher on the list of things that people talk about.
Well, so much has been done to increase the awareness and as far as research is concerned, but what's the next level? What's next?
Well, the next level is the global level, and supporting everything we've done in the United States. In 1977, when people were diagnosed with early stage breast cancer, their 5-year survival rate was about 74%. Today, in a perfect world, because of everything we've put together, that number is now 96%. We need to maintain that, and we need to increase opportunities people have for care, treatment, and again, supporting the patient care safety net for everybody in this country. And then we need to focus our attention in reaching our hand out, training and helping people all over the world with a very silent epidemic of cancer.
Absolutely.
It's enormous.
Well, I know, I have to say, it's because of you that we look at that pink ribbon differently today. So thank you very much for everything that you have done as well, too.
Thank you.
All right, and if you guys want to get more information on how you can get involved in the Susan G. Komen for a Cure Advocacy Alliance, all you have to do is log on to better.tv. You'll find a link to the foundation. Thanks again.